ever wondered how doctors see inside a patient's throat during an emergency? One of the most important tools they use is called the laryngoscope. In this video, you'll learn what a laryngoscope is, how it's works, and why it's so important in airway. A laryngoscope is a medical instrument. Doctors use it to look inside the mouth and through. It helps them see the vocal cords. This makes it easier to place a breathing tube into the trachea. This procedure is called intubation. There are different types of laryngoscopes. Each type is designed for a specific situation. Let's look at the most common ones. Macintosh laryngoscope. The Macintosh laryngoscope has a curved blade. It's the most commonly used laryngoscope in adults. The curved blade helps lift the tongues and expose the vocal cords. Many anesthesiologists use this type every day. Miller laryngoscope. The Miller laryngoscope has a straight blade. It's often used for infants and young children. The straight blade can directly lift the epiglottis. This can improve the view of the airway. Video laryngoscope. A video laryngoscope has a small camera at the tip of the blade. The image is displayed on a screen. This helps doctors see the airway more clearly. It's very useful in difficult intubations. A fiber optic laryngoscope uses flexible optical fibers. It can reach difficult airways. Doctors often use it when a normal laryngoscope isn't enough. Each type has its own advantages. The right choice depends on the patient and the clinical situation. The Miller blade is commonly used in infants and children because it can directly lift the epiglottis. However, both Macintosh and Miller blades can be used in adults, depending on the patient airways and the clinician's preference. Before using the laryngoscope, it must be prepared properly. First, choose the correct blade size for the patient. Next, attach the blade to the handle until it clicks into place. Then, lift the blade to the working position. This turns on the light automatically. Always check that the light is bright and working correctly. If the light doesn't turn on, check the batteries or the light source before using the device. Once everything is working properly, the laryngoscope is ready for use. Checking the fiber optic light path. In a fiber optic laryngoscope, the light travels through fiber optic bundles inside the blade. Check that the light path is clean and not damaged. A damaged fiber optic bundles can reduce the brightness of the light. If the light appears weak, the fiber optic bundles may need inspection or replacement. Checking the electrical contacts. Before replacing any parts, it's important to inspect the electrical contacts. Check the metal contacts on both the handle and the blade. Make sure they are clean and free from corrosion. Corrosion can interrupt the electrical connection and prevent the light from turning on. If you see any corrosion or dirt, clean the contacts carefully before testing the laryngoscope again. Checking the batteries compartment. Next, inspect the battery compartment. Remove the batteries and check for any signs of corrosion or battery leakage. The battery contacts should be clean and shiny. If they are corrected, the laryngoscope may not receive enough power. Clean the battery contacts if necessary. Then install fresh batteries and test the light again. Now, let's install the new light source. After replacing it, reassemble the laryngoscope and turn it on. The light should be bright, clear, and stable. If the light is still weak or doesn't turn on, inspect the batteries, the electrical contacts, and the fiber optic system again. How is a laryngoscope used? Now, let's talk about how a laryngoscope is used. A laryngoscope is used to help doctors see the patient's airway. It allows a clear view of the vocal cords during airway management. This is especially important when placing a breathing tube into the trachea. The laryngoscope helps improve visibility, making the procedure safer and more accurate. The laryngoscope is usually held in the left hand. The right hand is then free to handle the endotracheal tube and other equipment. A firm but gentle grip helps maintain good control of the device. Before using the laryngoscope, always check that the light is working properly. Make sure the correct blade size has been selected. Also, inspect the blade and handle to ensure they are clean and ready for use. After the procedure, the blade should be removed from the handle. Reusable parts must be cleaned and disinfected according to the hospital's infection control guidelines. Proper maintenance helps keep the laryngoscope safe and reliable for future use. Remember, regular inspection and proper maintenance are just as important as proper use. A well-maintained laryngoscope helps ensure reliable performance when it's needed most. Laryngoscope blades come in different sizes. The correct size depends on the patient's age and anatomy. Smaller blades are commonly used for infants and children. Larger blades are used for adults. Choosing the correct blade helps improve visibility and make the procedure easier. Like any medical device, a laryngoscope can develop problems over time. Common issues include a dim light, dead batteries, corroded contacts, damaged fiber optic bundles, or a loose blade connections. Regular inspection helps identify these problems before clinical use. But preventive maintenance. Regular maintenance is essential. Check the batteries regularly. Inspect the light source, clean the electrical contacts, verify that the blade locks securely onto the handle, replace damaged parts when necessary. Always inspect the laryngoscope before use. Never use a device with a faulty light. Always follow your hospital's cleaning and disinfection protocol. Proper maintenance improves patient safety. Did you know? Modern video laryngoscope allows doctors to see the airway on a screen instead of looking directly into the patient's mouth. This can improve visibility in difficult airway cases. Okay, everyone, today we learned what a laryngoscope is, its main parts, different blade types, how to prepare it, how to inspect and maintain it, and why it's one of the most important airway management devices. Before every clinical use, always verify the light intensity, inspect the battery contacts for corrosion, and make sure the blade locks securely onto the handle. A simple inspection can prevent equipment failure during an emergency.